Hi, I'm Tamara Starr, a speech-language pathologist at Providence Medford Medical Center.
Hi, I'm Carrie Fawcett. I'm a graduate student at Nova Southeastern University.
There is potential for serious consequences, including immediate death, when managing patients with cuffed tracheostomy tubes. This video is designed to inform you about speaking valves and caps and associated precautions when caring for this specialized population, which you may not treat every day.
Your patient may have either a cuffless tracheostomy tube or a cuffed one just like this. To find information about the type of trach being used or the size of the tube, check the neck plate which is attached to the trach collar. This plate secures the tracheostomy tube in place around the neck and provides information that will say if the tube is cuffless or cuffed.
In a normal airway without a tracheostomy tube, inhalation and exhalation occur through the mouth and nose. Airflow moving through the airway enables smell and taste, normal sensation, and of course, speech. Some tracheostomy tubes have a cuff to assure that all air moves in and out through the tracheostomy tube during mechanical ventilation.
A cuffed tracheostomy tube also changes a person's breathing patterns by only allowing air to move in and out through the tube instead of through the nose and mouth. Clinical complications include loss of voicing, psychological distress, inability to smell and taste, compromised nutritional status, impaired swallowing, risk of aspiration, and secretion management issues. If a patient has a cuffed trach, always completely deflate the cuff before using a speaking valve or cap. Complete cuff deflation is achieved when the plunger of the syringe is pulled back and resistance is met. There are two additional devices that will be discussed in this video: a purple one-way speaking valve and a red cap, also called a button.
A speaking valve, placed at the end of a tracheostomy tube, controls the passage of air.
The purple Passy-Muir valve allows air in through the tracheostomy tube for inhalation. The valve blocks exhaled air from exiting the trach, directing the air up through the nose and mouth. A speaking valve or cap allows for improved voice and speech, improved taste and smell, improved swallowing, may reduce aspiration, and improve secretion management. The patient's ability to cough is restored while strengthening respiration in order to eventually breathe without the tracheostomy tube.
The cap or button completely occludes the tracheostomy, allowing the patient to both inhale and exhale through the nose and mouth. The cap can be removed for suctioning or emergency ventilation needs. Both the speaking valve and cap are used to prepare the patient before the trach is completely removed.
Remember, before a patient's Passy-Muir valve is used, the cuff must be completely deflated by the respiratory therapist or the registered nurse. Never deflate the cuff or add a valve or a cap to a trach tube without a physician's order. After the doctor writes the order, the respiratory and speech therapists will advise staff on specific instructions for valve use, including when and how long the cuff should be deflated. These professionals will assess the safety and tolerance of using the valve or cap on your patient. If the cuff is not deflated before the valve is inserted, the patient will not be able to exhale and will die.
Only qualified personnel, such as the respiratory therapist, speech-language pathologist, or registered nurses, are allowed to touch the patient's tracheostomy tube. Certified nurses' assistants, patient's family and friends, or any other personnel are not allowed to touch the patient's trach. Remember to always look at the white collar to determine if it is a cuffed trach and ensure that the cuff is completely deflated before placing a Passy-Muir valve or a red cap. We appreciate the time you have taken to learn more about tracheostomy tubes.
You can direct any questions to me, Tamara Starr, or any Providence speech-language pathologist.